Well, good afternoon and welcome to this third week of the Common Practice. My name is Matt Rustin. I'm the Executive Director at Made to Flourish. And we're so glad you've joined us this afternoon on Maundy Thursday. And our desire with the Common Practice is to provide a weekly check-in where we can come together and connect as a network to share best practices on how we can shepherd the church in these uncertain times. And this week, our topic is pastoring healthcare workers in the pandemic. So many workers are being impacted during this time. I don't know if you saw the numbers that came out today, but almost 17 million people have filed for unemployment in these last 3 weeks. Many others have lost businesses. Many others are just struggling to hold on. But today, we wanted to spend some time thinking and focusing on one particular group of workers, healthcare workers, who face unique challenges in this environment. Healthcare is certainly a broad field, but as we enter into this discussion today, we're thinking about doctors, we're thinking about nurses, we're thinking about surgeons, nurse assistants, first responders, emergency medical technicians, basically those who are directly working with those who are sick with the coronavirus or providing support around them. And we want to think through what are the unique strains and stresses and challenges they're facing. And then secondly, how can we as pastors and leaders and churches step up to support them? So really excited about our panelists today. And we've got a number of people joining us. We'll have Peter Nenadov, who's the lead pastor at Lakeside Christian Church in Akron, Ohio. Keith Case, who's the lead pastor of Providentia West Palm Beach. Joe Knittig, who's the CEO of the Global Orphan Project. And in a second, we'll have Larissa Trushell, Dr. Larissa Trushell, who's at pediatric resident at Boston Children's Hospital, where she's a second-year fellow. And she'll be joining us in just a few minutes. So we're going to be listening and learning from them for the first half of our time together. And then in the second half of today's check-in, we'll give you a chance to engage them with questions and hear from some of you. So whether you're a pastor yourself or you provide leadership in your church, hopefully as they share, it can spur creative thinking for you in your context. Now, the primary way, it's a little bit different if you've tuned into past weeks with us. We had been using the chat feature. This week, we're actually going to be using the Q&A feature on the bottom of your Zoom window. So if you look right in the middle, there's a Q&A button, and that's the place where we would love to hear your comments, your questions. Send those at any time during the call, and we'll work our way through them. You won't all see each other's questions, but they'll come directly to us and the panelists. One final note, just to mention, we've taken steps to minimize any Zoom bombing. I don't know if you're aware of this, but it's been happening for Zoom calls, people logging on. But if on the off chance that someone does get access and is able to do that, as a community, as a gathering today, we'll just ignore that and we'll keep learning. So we're gonna go now to our panelists. And I think we have Larissa with us. Dr. Larissa, thank you for joining us. And wondering if you could start by just sharing a little bit of your context, your work context, where you're at, and letting us get a sense for your work that you do.
Hi, can you all hear me okay?
We can hear you great, yep.
Hi, thank you. I am a pediatrician and I work in an emergency department at Boston Children's Hospital, where I'm still in training. I'm in a second year of 3-year fellowship, and Keith is taking my picture. And so I'm on the front lines in the sense that I'm working in an emergency department that is seeing patients who have COVID-19, and there have been about 15 of them diagnosed in our hospital, but compared to the emergency rooms that are taking care of adults, we're seeing far fewer patients. So I feel like I'm sort of on the front lines. I don't deserve all the credit as the adult emergency medicine and the ICU doctors who are taking care of adults who have had some pretty overwhelming and severe volumes in their departments and their ICUs. So that's where I'm at.
Yeah, thanks, Larissa. And you're at one of the top pediatric hospitals facilities, really in the entire country. You're dealing with all kinds of different challenges and emergencies. What are some of you talked about maybe you don't feel quite as pressed as some of the other doctors in the hospital, but what are some of the greatest challenges that you're facing in this time? And maybe even some of the challenges that you're hearing from some of your peers, either colleagues that you're working with directly or just around the hospital?
Yeah, so I think for me personally, I have a 6-month-old who is actually almost 7 months now, and I think that that has been sort of my biggest burden is just the fear of bringing it home and giving it to her. In general, we know that kids do better than adults, but some of them, particularly kids under 1, are still at high risk for having severe disease and severe presentations, complications. So that has been a burden for me. I think you kind of do everything you can. I have like a whole system by which I try to reduce the likelihood that I'll bring it home. But, I think it's been a burden for me and a burden for my family, just thinking that it is sort of putting them at risk just by the career that I've chosen, which is, um, not necessarily something you think about when you go into medicine. There's kind of other risks that I've been exposed to, but nothing quite like this. And I think my husband and I have had to sort of do some reckoning about how this is, part of our vocation and part of how we serve. And that sacrifice isn't just a sacrifice for me, but it's a sacrifice for our family and for even our daughter, just putting her at risk. And, um, I've had a lot of time to sort of think and process that in the last few weeks, but I'm encouraged by the long history of Christians who have, taken care of the lepers and put themselves at risk for the sake of others. So it's we follow a Christ that laid down his life for others literally, and so taking on a small risk of an infection is um, one way I can kind of live out the gospel in work. So
Mhm. Yeah, that's something that maybe many of us aren't thinking about. But Dr. Trushell, I was on the website, the Department for Veterans Affairs, a government website, and they just talked about 4 primary risks that healthcare workers are dealing with. And one of them is the one that you just said. They have personal demands, they have families, they have lives outside the hospital, and you're in a place where you're being exposed to the virus on a regular basis. And that's part of the calculus that you're kind of having to deal with as even though you're taking measures, am I bringing this home? And that's something that your families potentially have to deal with. So that's something, thanks for reminding us of that. What else are you seeing in terms of other doctors? What are people talking about in the break room or walking into the hospital? Are there conversations you're having or hearing from other people that you're working with?
yeah, I think to answer your other question, um, talking to my adult caring colleagues, so my friends who work in adult EDs, it has become in Boston like quite overwhelming to the healthcare system, and they're seeing a lot of very sick patients. So like full ICUs, closing down admissions to EMS. One of my best friends, who's like the most competent, overachieving, cheerful mother of 3, researcher, ED doctor. Um, she's on our parish council, and she is like does all the finances of the church. She's just one of those people who does everything and does it so well. I think this is the first time I've ever seen her just completely kind of overwhelmed and like not even able to talk about like kind of the emotional burden that she's carrying right now. So they are seeing like there was like 15 intubations in one day, which is like unprecedented, which means, respiratory failure. The patient has to go on a vent and the ICUs are full. And so I think one of the big emotional burdens for people in that context is also just this idea of rationing care, which can be really ethically tricky and cumbersome and overwhelming. We've heard like reports out of Italy similar to that. So we're starting to have these meetings in Boston about what are the standards of care for like crisis management standards of care, which are different, obviously, and what does it look like to ration care and who makes those decisions. And I think even though we're starting to get there, we're not quite there yet, but even just like sort of the prospect of it, I think can be pretty overwhelming.
Yeah, there's this category that some people are using of moral injury, and it's just this sense whether you're at fault or you just see difficult choices being made, and you're around that context. That a lot of doctors are kind of carrying that it's a form of really trauma and almost PTSD that people are having. As a person of faith, love to hear you comment just for a minute or two. Have there been any practices or anything at all that either you or you've seen some of your colleagues kind of take with you as you're in that environment?
Sorry, ask the question again. You mean like,
Are there any spiritual practices or just times to get away, take a breather, or like
yeah,
what has been most helpful to your emotional, mental, spiritual health?
yeah. I think the usual things like um, getting outside, spending time with God, like trying to do just some normal things that you would otherwise be doing in life that's not happening right now. I think for my co-fellows, we've been trying to like do virtual Zoom hangouts and things like that, trying to just like increase connectedness. It's sort of this weird world we're living in. And so being able to kind of know that you're not alone in it, I think has been helpful. Um, I feel like I feel very well supported, and I don't know that I even deserve it because, like I said, it's not that hard where I'm working yet. Although I think that time is going to come soon. But um, there is, for anyone, I don't know exactly who all is on this call, but for anyone that's like a small local business owner, Honey Grow is this company is just one example, but this company here in Boston that is doing a buy one, get one for the whole month of April. So my husband and I have been ordering it just about every day because he gets a free meal or I get a free meal and he doesn't. But Allbirds gave away $500,000 of shoes. Like, I just think that there are ways that people can support healthcare workers. And again, I feel like it's a little undeserved sometimes, especially because there are many people who don't have salaries now and could be using the free meal probably more than us. But yeah, I think it has been sort of helpful for morale just to kind of see different businesses kind of come around, healthcare providers, and support us.
That's fantastic. Well, thank you so much, Dr. Trushell, for your work and for contributing today and giving us kind of a bird's eye view of what's going on in your context. So thank you for sharing. We're going to go now to Pastor Peter Nenadov in Akron, Ohio. And Pastor Peter is the lead pastor at Lakeside Christian Church in Akron. And as we got talking, Peter just has some really interesting ways that he kind of realized the need in his community and then sought to respond. So Peter, give us a window into how you and your church is responding.
Thanks, Matt. It's an honor to be on this call and with you all. For us, it was the very beginning of March where I had a ER physician in my congregation come to me and ask for a list of all the medical professionals in our church. And for him at that time, I think he was mostly thinking of how to collaborate among medical professionals should something happen during one of our church services. So that made me just take the time to write out a list of everyone in our congregation who works in the medical field. And then within 24 hours, I got an email from Made to Flourish, similarly asking for just a demographic breakdown of a congregation and what is the age spread of your congregation and what different vocations are represented in your church. And so that also made me take the time to put a little more information. Just so you know, I'm an average pastor of an average sized church. So we're right around 250 people. And so when I wrote down the information in the congregation, I wrote out about 21 people that were working either as doctors, nurse practitioners, or nurses. And we have about 100 people under 18 in our congregation, and then 150 people above 18. And then when I separated out retirees, I got to about 120 working adults. And so when I realized that we had over 20 people working directly in healthcare, that was about 20% of my adult working force. And until I was asked to do that as a pastor, I didn't quite realize how many of them were in those fields. And we have a pretty robust regional healthcare system in Cleveland, Akron, and Canton. And of those 21 people, I have representatives in all 7 of our major systems: University Hospitals, Cleveland Clinic, Rainbow Babies and Children's, Metro Health, Summa Health System, and Akron General. And so I realized that just within our ordinary congregation, we had 20 people working in these different industries representing 7 different systems in our region. So once this started to happen, and our governor was taking some pretty early and aggressive steps in closing things down, on March 3rd, which feels like an eternity ago, but it was only a month ago, he announced the suspension of any spectators at an event in Columbus called the Arnold Classic, which is more popular internationally than even in Ohio itself. But it's this bodybuilding competition that brings people from all over the world to Columbus, Ohio. And when he announced that no spectators were going to be allowed and the public expo was going to be canceled for that event, Ohio had no confirmed cases at that point in time. And he started then having a daily press conference with our director of the Department of Health for the state of Ohio. And so every day at 2 o'clock, our governor and our director of public health were having a press conference. Most people in the state didn't start tuning in until March 11th. On March 11th, they made it pretty clear that schools were likely going to be closed and mass gatherings of all kinds were going to be suspended. And then it was that evening that the NBA suspended the rest of its season. And so then March 12th, all schools were closed and they defined mass gatherings at that point, 100 or less, and soon it would become less than 10. So when that first happened, and I had just done the homework in my congregation to realize how many medical personnel we have, I reached out to them to say, help me see this from your perspective. This is your daily work. And to most of our citizens, there was no visible change from the beginning of March to the middle of March in their lives. And when schools closed in Ohio, we still had less than 5 confirmed cases of COVID-19. So I just wanted to reach out to them to say, what do you wish as a pastor that I would be reading that would help me understand what it is that you're seeing in your vocation? And so they sent me articles and website and just resources that I could look into to kind of get a window of this into their perspective. But I know very quickly when it comes to anything medical, I'm out of my league and I need friends who are a lot smarter than me and more skilled that I can reach out to and just say, help me see what you see. And all of them were very willing to do that. And then our state also dedicated a resource where any citizen could go and see on the Ohio Department government website updates about COVID-19 in our state. So we pretty quickly had information that we could then point the congregation to say, this is where you should get your information of how everything you're hearing translates to us at a local level. Shortly after that, then I reached out to all those same personnel and said, help me understand how, though I'm not a medical professional, we could be helpful to you. And most of them, just like Dr. Larissa said, initially identified childcare as one of their biggest needs. When schools closed and then daycare started closing, they quickly had to come up with solutions for childcare. And many of them have parents or their grandparents that are local that would love to help, but because they knew they were in a higher risk category for getting the disease, they didn't want to bring in their family members who were at higher risk, since most of them were settling into the fact that it wasn't a matter of if they're going to get it, but when they were going to get it. And so childcare became one of their biggest needs. And now they're trying to think through, just like the doctor had mentioned, when they get it, should they stay at a hotel? Like, how do they even protect their own family in the case that they get it? And right now, we're seeing more cases, but we're not at our peak yet. And so they're still trying to scenario future things here in Ohio. And they quickly also identified the lack of resources in PPE masks. And Ohio, though we are the 7th largest population in the country, we were pretty sure that we were going to need to stockpile resources that we had, because in the distribution of federal resources, we wouldn't likely be on the top of the list for receiving some of that additional support. And so then for the first 2 weeks, most of our medical professionals saw a dramatic dip in care. All non-essential procedures were canceled. And so for many of them, their shifts were shortened or canceled altogether because everything was now focused on saving up for what would be coming. And when I talk to my physician, the doctors who work in emergency rooms, they're used to environments where things change quickly and they have to scenario for running out of supplies. But we also have doctors who are surgeons and they're used to more controlled settings. And so for them, it was a big shift to now imagine being called into an environment where it's not scheduled and they have to think a little bit more on the fly. Just the anxiety that caused them, where they're brilliant people. They've been doing specialized care for a long period of time, but they are now likely going to be called into an environment where they're a little more insecure. And so just feeling that need for support and prayer. And then we have others, one of my EMTs who isn't coming home to young children. He's still a single guy. Once everything slowed down here in Ohio, he's like, I feel like I'm trained and equipped and I want to be involved. And so he signed up to join FEMA and to be called to a hotspot. And so we're right now, he will in 24 hours get his assignment of where he's going to go to serve outside of Ohio to be more helpful in that environment. So then the third thing that I've now tried to do with all of them, recognizing that when the peak hits for us, their energy and their time will all get more limited. And I don't want to be a burden to them as a pastor to have them either try to write me long emails or have long phone calls. And so I just asked all of them that if they would now think about when that comes, how I could stay in touch with them to pray with them and support them. This is something that I've often done in doing pastoral care for people who are undergoing chemotherapy or other treatments where the treatment itself is just taxing on the body. And so their mental energy is limited and their physical stamina is restricted. That if they could take several prayer requests that they might have, but summarize them in one word, what would that word be? And that I would know in that one word, it means so much more than that word, but it'd be a way that they could focus their thoughts when they don't have a lot of energy to think. And so is that word peace? Or is that word strength? And that when this surge hits here, that they can just text me one word. They don't have the time for a sentence or a paragraph, but then I can know and be praying alongside of them, not wanting to encourage sort of the vain repetition that scripture warns against, but trying to live out in Thessalonians where it says to pray without ceasing. Like, how do you pray without ceasing in your work when your work is so mentally taxing? And so that was just one idea, and trying to capture that from all of them now has just been a joyful way to connect with them and identify their needs and anticipate what their needs might be.
Well, that process, Peter, just how you went from learning to then asking how you could support them, and then just the simplicity of just a word and just showing your support and encouragement. And thank you for all the information and the ways that you're leading your congregation to serve those in need at this time. We're going to go now to Pastor Keith Case in West Palm Beach, Providentia Church. And Keith comes to us not only as a trained pastor and trained in theology, but also as a licensed counselor. So Keith, you have an interesting mental health perspective on this and even some history working with medical professionals. Tell us a little bit about your context and the ways that you've been thinking about reaching out and supporting those in the medical field.
Hey, Matt, and hey, everybody else. It's good to see you guys. Hopefully the audio is not too choppy. It was a little choppy coming through on some of you when you were speaking. So if that's a problem on my end, please let me know. I am here in West Palm Beach. Before that was in Miami, and that's actually how I got connected with Larissa, Dr. Larissa, who was on there at the beginning. And in our time in Miami, our church was in the financial district, and there was a lot of medical students there, as well as residents and fellows. And so I started building relationships with them. And one of the things that happened out of that was discovering that the process of becoming a healthcare professional is pretty unhealthy. So these people who are now overwhelmed, as Larissa said, they already had very thin margins in their lives. And so I started working back in as early as 2011 with the medical professionals in Miami to say, how could we make the process of becoming a healthcare professional healthier? And what came out of that was I began to facilitate essentially process groups for medical students. And these were open to any students, multi-faith, very diverse. And out of that, it became actually a student organization. And then Larissa, who spoke earlier, she went on to Boston to do her residency and her fellowship, and actually began to do this type of work there as well. And one of the things that I discovered that I had no idea about was that for medical professionals, mainly doctors and students, that the suicidal ideation rate is twice as high in that population than it is for the normal population. And again, it just goes back to the lack of margin in their life. Some of them working, 60, 70, 80 hours. On top of that, then they're studying. And then they may have a marriage or kids, or they're dating someone. They have a family member who dies, and they get to fly home maybe for the day to funeral, and then they're right back into caring for patients, having somebody die on them for the first time. So anyway, since 2011, I've been in this space, and it's been an honor to just learn. And I'm by no means an expert, but it's been just a place of curiosity for me, and a place that people like Larissa and others have been so kind and gracious to me to open doors and welcome me in. Here in West Palm, for me as a pastor, probably 3 weeks ago, I guess it was March 12th, a friend of mine is the health advisor to Microsoft and reports to the CEO there, and basically said, this is going to get really bad. That, at that time he said, if the government doesn't do anything, millions of people are going to die. And I was just like, what is this guy talking about? And I knew for our little congregation, at least from the reports, it wasn't really affecting our demographic from a healthcare standpoint, but it was affecting them from going to affect them from a financial standpoint. But soon after that, beginning to realize that the doctors were already beginning to get maxed. And so I, as a counselor, put up on Facebook and I believe on Instagram and Twitter that I was going to open up 2 free slots to see people, medical professionals here in the state of Florida. And pretty quickly started not only getting calls or texts locally, but also from across the country from doctors that I had relationships with who were looking for that kind of support. Unfortunately, I can't offer that to people outside of the state of Florida, but I began to look for resources for them in their city that they were in or in their state that they were in. So I've now opened that up to 4 slots. I'm now counseling, have 4 slots available for medical professionals, and began seeing people last week or 2 weeks ago. And it's interesting. I mean, a lot of it is talking about the realities in the hospital room, but what it usually gets back to is just, when they get home and their relationships with their family, similar to what Larissa was talking about, processing the fact that they're putting, their family at risk. They're dealing with anxiety. They're dealing with things that normal people are dealing with, but they just don't have the margin and space to really talk about it and process it. So that's what I try to create is, hey, this is a space to breathe.
Mm-hmm. Yeah, that's good. Keith, I'd love to hear some of your experience just in terms of what people are sharing in terms of the actual stressors or needs that they have. On the website of Veterans Affairs, they list stressors like physical strain of protective equipment, pressures regarding procedures that must be followed, the tension between public health priorities and the wishes of patients and their families regarding the quarantine, inner conflict about competing needs and demands, fears about the infection and bringing that home, possible separation from their family members. So there's just all sorts of different mental health challenges and things that are coming at them at the same time. Is there a theme or two that you're hearing in people that you're talking to?
Well, one thing that that I talk to doctors about a lot is that, and I guess all of us face this to some degree, but doctors are in they are working to keep people alive, and at the end of the day, we all die, and so they have this really there's like this end of life thing that they have to deal with. And, doctors that I'm talking to are fighting to keep people alive. But like Larissa said, they're seeing so many people in such intense situations. The ICUs are overwhelmed and people are dying at like higher amounts than normal. So it taps into that failure and a guilt thing. I mean, a lot of the doctors that I know are high performance people. They not only could be a doctor, but they could also be a singer on Broadway. I mean, they're writers, they're multi-talented, and they're very driven. And so they're driven, and they want to see, they want to be successful at what they're doing, and they want people to be cared for well. So to actually face the realities that masses of people are dying and that they're not able to keep them alive is one of the themes that has come up for those that I'm dealing with. I think another one, and I don't think Larissa mentioned this, but I talked to a doctor, because I've reached back out to all the doctors who are part of our church. Some of them have moved away to other cities, but another pediatric doctor who's going to be moved to the adult ER. So he's going to be, shifting his focus from kids to adults because of the need. And I think Peter mentioned that as well, that he had one of his doctors at his church is now signed up with FEMA. So he's going to be flexible, and he's going to be trying to adapt to, maybe a specialty that he hasn't been working in. So that adaptability piece is another stressor for them right now.
Great. Thank you so much for sharing and all the work that you're doing, Keith. We're going to close our last panelist, and then we'll have some time for questions and just comments from all of you. But we want to go to Joe Knittig, and Joe Knittig is the CEO of Global Orphan Project, and they also run a program called the Care Portal. And this is a really practical tool. I was excited to have Joe join us today, because Joe and his team have developed a tool that churches really practically can use to support people in their congregation and those maybe in their community that are working in hospitals and just emergency workers. So Joe, thank you for joining us. And could you tell us a little bit about Care Portal, what it is, and the specific tool that you're developing in this time to assist churches?
Yeah. So I'll kind of talk through pre-COVID ID or COVID-19, what is Care Portal. So our bullseye in our ministry is orphan and vulnerable children. So in the United States, it's the United States foster care system, which has about 4 million kids that get hotlined per year, and about 400,000 kids that are in foster care. And so if you go county by county in the United States of America, there's a massive care infrastructure for vulnerable people, for vulnerable children and families. You'll have caseworkers that are in public agencies, private agencies. They could be with child welfare. They could be at a crisis pregnancy center. They could be in a hospital. And they're interfacing with kids and families in crisis. In that same community, you're going to have so many local churches. I mean, the greatest distribution network for care on the planet is the church. And so about 350,000 churches and parishes in the United States. And so pre-COVID-19, we looked at that and said, why do we have such an orphan crisis in the richest country the world has ever known, with such a massive care infrastructure and $30 billion of taxpayer money poured into the child welfare system? And the main problem was connectivity. The caseworkers that were interfacing with kids and families in crisis could be 3 minutes away from 5, 6, 7 local churches that would be willing to help those families, but they don't know one another. So what Care Portal effectively is a technology that connects those. Think of it as the Uber of child welfare, that a caseworker interfacing with a child or a family in crisis can get on her phone through an app or through her laptop and enter the need. It gets scrubbed for confidentiality. And for every local church in that community that signed up for Care Portal, it makes the connection, and then churches say yes to meet the needs, and needs get met and relationships get started. And so about 2,300 churches in 20 states around the country have served about 59,000 kids through Care Portal. We're anonymous. We want the local church to be the hero, not us, but we provide that connecting tool. So when this crisis hit, we're sitting here going, wait a minute, we've developed a technology and we've poured a lot of resources into this technology, and in the local church, we have access to this distribution network. Is there a way for us to build a micro platform leveraging the technology for bullseye needs in the COVID-19 crisis and maybe go from 2,300 to 10,000, 15,000 churches around the country and centrally support them out of our office here in Kansas City. So online, rapid on-rolling for churches and agencies. And so we did that, and we actually launched that disaster relief platform tomorrow on Good Friday. And here's where this topic is so relevant. We've been meeting with the U.S. Department of Health and Human Services and caseworkers and others, all around the country and developing this. And we went to HHS and said, all right, if you could give me just 3 needs that are at the bullseye of this crisis that you would be asking churches to help step up to meet, what would they be? And the first that they told us was support an emergency worker. Before we get to the vulnerable children and families and the elderly, if we're not caring for those who are at the front lines of caring for everybody else, then really we'll be fighting a losing battle. So the first need in the disaster relief platform of Care Portal that will go live tomorrow will be support an emergency worker. And what that will mean is 2 possible things. So Pastor Peter's church, just your church that you're talking about, if your church were to use Care Portal, you could build right on the technology a response team. You could go to your church and say, hey, who's interested in seeing needs of kids and families in crisis in our own zip code? And let's say 50 out of the 250 say I am. Care Portal would seamlessly allow you to build your own private response team. You could then go to emergency workers that you know of in your church, or for example, maybe in the community that are coming to you. They've heard that your church is a place that supports them. And you could use Care Portal as your own private platform to make those dots connect in your church. Or we'll go into hotspots like New York City, Chicago, other places, and agencies. An agency could be a hospital that says, man, I've got a family here and they are in tough spot. They need help. That help could be any number of things. It's going to be very, very subjective. So we said, well, you could put that need in, and could churches essentially adopt an emergency worker? And the ask of the church would be, when that gets entered by the hospital or the agency that's entering it, that would just make a direct connect. Can you raise up a family in your church to just be the church? Make a phone call, find out how is it going in your household? What can we do to wrap around and support you? So really our role is to make connections around needs and the bullseye of the crisis. And the first one is to support an emergency worker, and then let the church be the church.
Love that, Joe, and how you're developing technology to really link the church with needs in the community. And if I understand, as you're explaining this, a church can view it either as, how do I reach out to my local hospital or place where we can hear needs from emergency workers and get those with people in our church to respond, or you can be a person like Pastor Peter, and we know we have 21 people in the health care, and they can be connected to that resource and notify members in our congregation as well. So it's either the broader city or it could be congregation specific. Is that correct?
That's correct. So the church wouldn't have to be the one reaching out to the agency. All a church would do is go to careportal.org, click the COVID-19 dropdown. They would watch a series of videos. Of training videos. It would take all of about 30 minutes. They can enroll their church and then sign up for an online. We'll do about 6 or 8 online training sessions that take about 45 minutes. So in a matter of a day and just a few hours of time, you can be spun up on how this works. And you're right, you can use it intra-church as a care connecting platform for church-entered needs, but agencies can also enlist. And when agencies enroll, like a hospital that says, oh my gosh, I want this, I want to have access to these human resources at this time with all this lack of margin, then if that church has signed up and they've built their response team on Care Portal, a very simple process, They can see their own needs, and you're correct, or agencies that entered needs will enter them, and the system essentially uses georadius technology to say, all right, these needs are going to go out in a 5-mile radius if it's densely populated, or if it's more of a rural setting, a 15-mile radius, so that we get enough churches that churches are responding and encouraging the agencies that, hey, wait a minute, this whole church thing is pretty amazing. I might have had a dim view on this before, but so we've had about 33,000 reviews from caseworkers that have used this on a 1 to 5 star basis, and they've had a 4.5 star rating. It's actually a ministry to the hospitals, to the caseworkers that are at the front line too. And, you know, I would just sum up by saying, we really believe that amidst all of this crisis, this is an incredible hour for the church to be the hands and feet of Christ in very practical ways to neighbors that are in crisis. And I don't wish this harm on anybody. None of us do. But in the midst of it, God has gone ahead of us since the stoning of Stephen and prepared this distribution network to love our neighbors well. And we just want to play a teeny tiny part of leveraging technology for the real heroes that are the churches and the families that are providing the love. And I have to tell you, it's been so encouraging. You read these terrible studies about how the church is dying. I don't see that at all. I see the church thriving and stepping up. In the month of March, Care Portal churches have met more needs than ever.
Thank you for your work, Joe. And I love your reference to Acts, that the same church that met and fervently prayed and did all these sacrificial things also set up a distribution network with Stephen and widows. So there's both logistics and prayer and all those things in the early church. Just a reminder that you can submit any questions in the Q&A panel, and we've got some comments, and we also want to hear things that you're doing. So I love this comment from Jeff Ward. He says, as a church, we've been talking about a prayer tour with caravans of cars to area hospitals. We've been thinking about food delivery to ER departments, and also just some other actions they're taking. So thank you for the work that you're doing, Jeff, at your church. Other questions that have come in. One is just about Care Portal, and just a clarification, Joe. Can church members, if they sign up to say, I want to be a person that can respond, can that just be a one-time thing? Does it need to be an ongoing? How much of a commitment are people signing up for if they use the Care Portal resource and say, I want to be a part of the team to respond?
Yeah, so we ask churches to sign up, not necessarily the individuals. We want to make sure that the leadership of churches are honored, and you know, the care of people as a ministry of the church. So let's say a church enrolls and they go to the people and say, who wants to be on the response team? The only thing you're signing up to do is you're saying, I'm willing to see needs. You're not actually making a commitment to meet them. That will have to be the Holy Spirit's job in your heart. So you can meet as many needs or no needs, but when you sign up to be part of a church, your church's response team, it just means you're saying, yes, I'm willing to see these needs. And really you decide based upon your own life and circumstances and working with your own pastor and your church.
That's great. I want to go to Pastor Keith Case in West Palm Beach, and you're both a pastor and a licensed counselor, Keith. And I'm just thinking, for probably many of the pastors, many of the people listening on this webinar, they aren't trained counselors, they aren't trained professionals in that area. And sometimes the best way to help is just to link someone to a licensed counselor that is trained to do this. But I want you to just keep your pastor hat on for a second. What are the types of questions? What are the types of postures that you're just thinking through as a counselor that might be helpful for some of the pastors on this call as they interact with people in their congregation or in the community?
You know, the medical professionals actually having a space to breathe and talk if they're up for that. I know all of us have probably said this more than once, but their margins are so thin that they may not have the capacity for that. But if they do, just to be listening, to create that space just to listen. You don't have to give any answers. You don't even have to, and this may sound weird as pastors, but you don't even have to necessarily give encouragement. If you can just give them space to talk about the realities that they're facing. And there are things that do come up. And I think for a long-term play as pastors, or for kind of long-term issues that we can address, the one that I mentioned over the failure, that issue of being a failure, if they've had patients die on them. And I think, Matt, you and I talked about this, that there's trauma that's happening for the entire medical community right now that isn't just going to go away after COVID is over, or Corona, the virus kind of slows down. This is going to be something that they're going to be needing to process, and the gospel has something to say about us feeling that we have failed in our work. Made to Flourish has something to say about that in particular, as a faith and work organization. So as pastors, being engaged in this conversation, the faith and work, understanding the caveats of our faith and our work and how they go together, understanding our limits, that we're not God, but we're called into this service, that every day we go out and we deal with toil and suffering and failure in our work. And do we have a robust faith that aligns to help us deal with that? So I think, immediately just trying to listen, reaching out to their families to pray for them. We have a thing here that we're doing where we're praying for the emergency rooms closest to our house in our church, but also trying to, be aware of the medical professionals in our community and what they may need as far as how we can care for them. But then long term, as pastors, how do we create support systems for these medical professionals after this is over, is something I think too that we can begin to think about. I think you're muted, Matt.
I don't know if Dr. Trushell is able to answer. I know that you're caring for a small child at this time, so if we have to go out, we can. But a question came out about, in your work in the hospital, what do you wish would be true of what you could say about the church and the response of that? And I'm hearing right now that you're caring for a loved one, so we're going to come back to Dr. Trushell. Maybe we'll give you the last word, but those are some of the on-the-spot realities of what our medical care workers are facing. We'll maybe send just one more question to Pastor Peter, and we'll send this out. Peter, as you've been interacting with people that have either responded by text or not, I guess, I'm not sure if that has been happening yet. What are the types of things that you're hearing are fears from doctors, or just other ways that you're considering kind of in the next phase to support doctors in your congregation?
I'd say right now, peace has been the most consistent word that's come up, because for some of them that seems to encapsulate the needs in their own home. And so our doctors with young children have one set of needs, but our doctors and medical professionals with school-age children, they're trying to manage this increased load, and they don't have any margin to really oversee the home education of their kids. And so if they don't feel guilty about their work, they feel guilty about their parenting right now. And so just that peace in the home, peace in the workplace, and then recognizing being a peaceful presence to their other coworkers. Just like we can't take the burden from them, they can't take the burden from their colleagues. And so they themselves wanting to be a peaceful presence. One of my doctors, up until this point, he usually just gave cortisone shots. He was physical therapy, occupational therapy, but he has an administrative role where he oversees the scheduling of 200 physicians. And so he has this, I'm overseeing your scheduling, and I want to lead you well, and I want to care for you, and I want to be a peaceful presence to you. So that's been the most consistent shalom, because it covers all those different areas. But I've encouraged them that don't be afraid to just say help or mercy. Like when everything hits the fan, please also feel the freedom to use other words. So.
Yep, that's great. I want to maybe two final questions, and we're going to go to Dr. Trushell when that becomes available, but it might not be yet. We'll start.
I'm in an okay spot. I think I can answer your question. Yeah.
We're going to go to Dr. Trushell. Dr. Trushell.
You can call me Larissa.
Yeah, no worries. As you think about the hospital where you're at, your colleagues, everyone that is working there, the point is not to put the church front and center, but what would you hope would be true about the church responding to where you're at in the hospital during these times? What do you hope would be true, say 2 months from now?
Yeah. I think the church has a long history of being a part of relief efforts and humanitarian efforts. The Red Cross was sort of founded on Christian principles. A lot of organizations that are now secular were originally missionary organizations. And I guess I think, I don't know that there's one specific story, but I do think that as people who love the Lord and care about the hurting and the lost, like just being creative about ways to care not only for your congregation, but sort of more broadly, people outside of the church too, who might be experiencing tragedy, isolation, loneliness, and whether it's one of my friends is delivering groceries to an elderly woman upstairs, just in big and small ways, just being able to be the hands and feet of Jesus to people who are hurting or broken. And emergency medicine doctors love food in the ED because sometimes you don't have time to eat. So things like food deliveries, like just being very practical. I think one of the I don't really have an answer for this, but a lot of the family members who have COVID are dying alone, and that is horrible. And even like ICU nurses who normally would be in the room very often are not in the room because they're minimizing their risk. They're not supposed to be in the room unless they have to be. So thinking about ways like, I don't know if there's ways to put iPads in rooms or help people feel sort of the presence of others when they have to be alone. That's just something I've been thinking about recently. Like, could a church donate iPads to ICU so that people who are dying had people who could talk to them? Or I don't know. So I just think using sort of the creative spirit to see needs and meet needs is part of how we can serve. But yeah, I think, we know that God is in control, and that in the end, like, there's a hope in that. I think a lot about my friends who don't know that and how they're processing all of this. And yeah, there are great deep needs, and I think that they will grow deeper and wider in the next couple of months. And there really is at this point no sort of clear timeline or end in sight. So finding ways to meet those needs and trying to figure out creative opportunities starting now, I think would be what I would hope for.
Yeah, I love that vision of the church being this rallying community that cares not just for its own, those who attend, but the broader city, the broader community, and to really have our antennas up for what are the areas of need and places we can step in and to be creative with that. I love your suggestion, even of, is it iPads or whatever it would be. And we're going to give the final word to Joe, because Joe, you're really creating a platform that really allows those needs to happen. And you've told me that you're making this free of cost, this service for churches during this time of COVID-19. Give us just one final plug. Where can churches go to do this? It starts tomorrow, but you're making that free of cost. In fact, one of the comments on this thread was from a pastor in Ohio. And he just mentioned that they've delivered, to your point, Larissa, maybe 500 boxes of hope, they said, that will feed a family for 3 weeks. So they're not doing just one meal, but 500 boxes that are kind of 3-week packages for emergency care people in their community in Ohio. So I love that. And they've really been helped by the care portal function. So give us just a final word on where churches can go for that.
Yeah, so as of 5 p.m. tonight, this will go live and be ready to go tomorrow. You'll go to careportal.org. There will be a COVID-19 pop-up on the homepage, and all you have to do is click on it, and it will intuitively guide you to your place. This will be no charge to churches that are meeting needs to use it, and no charge to agencies that are entering needs. We'll fund it outside of it, but we want money to be no barrier to loving our neighbors. And probably the last thing I just would leave you with is thankfulness and encouragement. We've just heard from two pastors, and the level of thoughtfulness and all the nuance of how the church can care for emergency workers and neighbors. We have that all over the country in churches. And if we can just connect these dots and do what these leaders and all the people on the call have been made to do, this can be one of the finest hours of the church in our country. And I'm praying for that.
Well, thank you, Joe. And I want to ask Peter to pray for everyone involved, because there's people on this call that are pastors. Obviously, we have people like Larissa, people that have loved ones. I had a comment here from Delwyn Campbell, and she said that my sister's a nurse, so I'm really concerned about what to do with her. There's people on this call that have loved ones that are in the medical field, and then how the church would respond. Would you close our time in prayer, Peter?
Sure. Heavenly Father, we come to you and we do ask that you would help us to see the opportunities that we do have to serve you in this hour by serving our church members and our communities and our citizens, by serving our healthcare workers who are on the front lines where the vulnerability gap is closed and they have more risk of becoming sick from the very thing they're trying to cure. And so we pray that your protection over them. We pray that you would help them to be human, to be honest with their emotions and their thoughts. And when their margin is even less, that they would find ways to reach out for help and be supported in this time, because we know that they need it. And we pray that for those of us who are more in a position of supporting them, that again, you would help us to be creative and imaginative and to think new thoughts and dream new visions of ways that we can help one another and bless each other and shine the light in this very dark time. But we thank you that none of this is a surprise to you, and that you are good and gracious, and that your purposes for us are ultimately for our good and growth. And so we pray that you would help us to just maintain a posture of humility that works as hard as we can, but can also rest in you and trust in you through all of this. In Jesus' name, amen.
Amen. Well, thank you, Peter. Thank you, all of you, for joining us. And we're going to be back here at the same time, the same place next week, talking about pastoring those who are unemployed and what are ways that the church can support those who are looking for work and during this time. Final word, if you have stories about ways that you're reaching out to hospitals, doctors, nurses, and unique ways to support the local healthcare community, please do email those stories. We're collecting those in this time. Thank you, everyone, for joining us. God bless you, and God bless you on this Easter weekend.